Dr. Anwar, thank you so much for taking time today with us to talk about COVID-19 and the precautions that we can take. Our team in India greatly appreciates your suggestions and recommendations. So I'll get right to it. They formulated a list of questions for you.
Okay.
The first question they had is, what is the first thing to do when I am showing symptoms of COVID-19?
Thank you for having me. My first suggestion to everyone is isolate. If you're in a small home, don't worry about it. Isolation can mean wearing a mask. Put a mask on. If you have anyone around you who's a loved one, ask them to wear a mask. Then next, figure out where you can get testing done. Whether it's a 3-day test or an immediate response test. Those are the two types of tests. Find out, get that done. And then figure out what you're gonna do.
So I have a question, Dr. Anwar. So when you say symptoms of COVID-19, can you just give a sense of what kind of symptoms should trigger us to start thinking about it as a possibility of COVID-19?
Even a normal sneeze during COVID time is considered as COVID. That's the definition of COVID now. You sneeze, you have COVID. So until proven. So what you do is, if you have a runny nose and it seems like you're usually at this time of the year, you have allergies, don't take it for granted, because this is the only way to contain this and get rid of COVID. To eliminate COVID, you have to think any symptom you have in your body is COVID. Runny nose, sneezing, sore throat, body ache, chills, stomach ache, diarrhea, any of those symptoms. Some kids presented with a rash. Consider that COVID too. You never know how COVID presents. It's very different in every single patient.
So what you're trying to say is we should assume it's COVID until it's proven it's not.
Absolutely. That's what I'm trying to say.
Okay. And with regard to isolation, if I'm living in a household with my extended family, and do you recommend everyone wear the mask in the house?
Absolutely.
Even if I'm the only one with the symptoms?
It doesn't matter. You want to contain it. Again, the word is containing a infection, right? You want to contain the infection. So what you do is ask everyone to wear a mask. The person who's presenting with those symptoms should be isolated in a space, whether it's a small space, whether it's a large space. Isolate them. Don't go close to them. So make sure, even if it's a 1-bedroom house, isolate yourself. Stay away from that person who has the symptoms by at least 6 feet, because it's an airborne disease. It goes through the air. So they say that 6 feet distance is the one that's going to prevent you from having the...
Got it. Despite the mask, maintain the distance.
Maintain the distance. 6 feet, 6 feet, 6 feet.
Got it. And what about if my family member is presented with COVID symptoms and I don't have symptoms? Am I also supposed to wear the mask?
Absolutely. Again, everyone in the household has to wear a mask. Even though it's your own family, it's your family members, no one from the outside is coming in, you still have to wear the mask.
So can you talk about if my family member has COVID or has symptoms of COVID, am I allowed to go out and do my regular day-to-day tasks, or should I also be taking precautions to avoid contact with others?
Absolutely do not step out of the house unless it's an emergency, unless you're going out to see a doctor or you're going out to get your testing done. Do not step out, because again, the key to containing this infection and getting rid of COVID is to stay in isolation. The moment your family member, you or anyone in your family has COVID or symptoms of COVID, isolate yourself. Don't go out.
I'm sorry, I'm trying to repeat myself, but I want to clarify. Even if I'm not the one with COVID symptoms,
doesn't matter.
I'm not allowed to go out as well.
Because you have been exposed by your family member. So you are considered a potential for future infection.
Got it. Okay. That is very helpful. So the next question is, should I take the COVID patient to the hospital? Is that recommended? What is your suggestion to that?
So first we start with, hey, first symptoms, getting tested. The test came back. Please, I do want to reiterate one thing for all of you. Do not get a CT scan as your first option to get diagnosed. You do not need a CT scan. You need a CT scan under only one circumstance. You got the symptoms, you're progressing into a more shortness of breath, coughing, and your oxygen level drops to below 90 is when you get a CT scan. Now, your question, what was your question? I'm sorry.
The question is, if a family member of mine or anyone that I know is a COVID patient, should I take them to the hospital?
Do not take them to the hospital. I'm actually going to get you a list of medications that you can actually go ahead and store it in your house. Like in Houston, we have a hurricane season, but we have certain hurricane supplies in our home that we always have it every year during hurricane season. The same way, this is COVID season for you guys. I'm going to give you a list of stuff that you should store. It doesn't matter if you don't use it. It doesn't matter if they go to a waste. Buy a reasonable amount. If you have 5 family members, buy enough for 5 family members. Each dose of each medication should be enough for those 5 family members. I'm going to send the list. I'm going to make sure it's emailed to each one of you so you can go ahead and buy those medications. Now, let me talk about when is a hospital admission needed and when is it safe to keep a patient in the house. With the current situation in India, we don't have oxygen. We don't have ventilators. The only thing you will be doing going to the hospital is you will be actually isolating a patient, but you're actually exposing your loved ones to more super infections from all the sick patients around you. So you do not want to do that. You want to keep them in your own home and start on a medication that is very detrimental to how your body reacts to COVID-19. And that is a steroid, a specific steroid that has been studied in the last 1 year. And it has proven in my own practice and with other people, like that steroid stops your body from overreacting to COVID-19 virus and preventing your body from shutting down. And that is very, very crucial. So the moment anyone is proven that they have COVID-19, I want you to go find this drug, start giving it to them. So what is this drug and how does it work? So when any infection attacks your body, what does your body do? You know, you have 2 kinds of immunity that your body has. One is a innate immunity, and the second one is an adaptive immunity. Innate immunity, for a layman's words, is like a firefighter and a sprinkler system. The moment the fire goes on, the sprinkler system starts and you get rid of the fire. The same way that innate immunity is the moment your body is exposed to a virus or a bacteria, your body goes crazy trying to attack it, to kill it, to contain it, right? That is the one that determines who reacts to COVID the way they react. Some people, most of you have a question, who survives this COVID and who dies in this COVID? It's the way your genetic component of your body is, whether you have predisposing conditions like hypertension, diabetes. Even they have proven that even your blood type determines how you react to COVID-19. So this innate immunity is the one, if someone is not able to fight that fire that's inside your body right away with the sprinkler system, you get attacked by COVID. And the consequences of all the possibilities of what COVID can do to you can happen to you. So your immunity is the one that determines how you fight and how you don't fight the infection. So I don't know if I've gone into detail, but
so maybe I'll just ladder it up to the question. So it doesn't matter who the person is, what type of person it is. We're going to take the same precautions. Is that correct?
Exactly.
Because we don't know how
each person reacts.
So in the unknown, it's better to just take the precaution that everyone may react the same way. So take the same steps.
Exactly. You're just, you just have to assume, oh my God, I survived COVID. I was just lucky, not because of any other reason, but because you were lucky that your body actually had the immune system to fight it.
So the medications like paracetamol, antibiotics, vitamin C, all of that are just...
They don't work. Actually, generally, they're not. So what you're doing with paracetamol is you're keeping the fever down. You're taking vitamin C, you're taking zinc, you're taking all that. I mean, yes, those are really good, important minerals in your body, but are they going to fight COVID? No. And another trend I've seen with Indian doctors is they're giving them multiple antibiotics COVID-19 is a virus. It is not a bacteria. No antibiotic is going to help you. So please stop taking antibiotics, because the only thing that it does to you is it weakens your body. It's not allowing your body to fight this COVID-19 virus. So we have to stop giving patients so many antibiotics. Antibiotics are nothing but small doses of chemotherapy that weakens you. Stop taking antibiotics, please.
Okay. So when should we be prepared to take a family member or someone in need or who has been identified with COVID to the hospital? What is that sign that we should look out for?
Honestly, Fakhru, I tell everyone, please do not take them unless their oxygen level drops below 85.
Okay.
But my advice is, again, I don't know what the situation is currently. If someone, like I talked about the hurricane supplies, other than these drugs, if someone can get a CPAP machine, it's like an oxygen concentrator. You take the oxygen from the air and it concentrates the oxygen and the patient is supplied with that oxygen. If they are able to find CPAPs, that's something that I would highly recommend everyone to find one and keep it as an emergency.
At home?
At home.
Okay.
Like one CPAP machine for maybe 1 or 2 families that, God forbid, if their family member gets sick, they should be able to use that oxygen concentrator. It basically takes the air, from the atmosphere, and it concentrates the oxygen. So up to 85 drop in the oxygen level, you'll be able to compensate it.
So if it goes below 85, recommendation is
finding a hospital that has oxygen and a ventilator. I know it's hard to find a space. I know it's hard to see your loved ones suffer, but do not take them to the hospital till it hits about 80. That's what I say, not even 85, till 80. If you have a CPAP, push it. Push it with the steroids that I'm going to recommend. Push it. You should do fine.
Got it. What about if there are pre-existing conditions such as diabetes or heart conditions and they're struggling with COVID? Should we take any extra precautions or do anything different because of the pre-existing conditions?
It's too late. They're already existing, right? So what can you do? We don't know how your body is going to react to COVID. We don't know anything. And right now, all my recommendation is that, the moment you get those symptoms, contain it. Again, if someone already has those pre-existing conditions, and if there's 6 family members in a family, if all of you get infected, you're going to put more pressure on that person who has pre-existing conditions, because you could have gotten one variant of COVID-19. The other person could have gotten another variant of COVID-19. But this person who has the pre-existing condition might have another variant. But if you're around this person and you're infecting her with different variants, you're going to make her sicker. That's why isolation. That's the way to prevent this infection from getting worse on a person who already has an issue.
So if I was to simplify this, what you're saying is, in a household of 5 to 6 members, even if all of them have tested positive, you still recommend the isolation from each other.
Absolutely.
With the masks.
Absolutely, because you never know which person has what kind of an infection, because there's so many variants.
Okay, understood. All right, and then what about if a person suffering from asthma has tested positive for COVID? Is there anything extra or any other precautions that we should take?
Actually, the same regimen is going to go for everybody. So what I have done in my practice the last 1 year that has worked wonderfully is I give them a combination of an inhaler, one kind of inhaler, and there's one more kind with the steroid, and a combination of a long-acting inhaler, and then the steroid, like I talked about. The steroid is the main thing, and then a cough syrup. Even those patients with asthma will get the same regimen. Everyone is the same.
Can you, for our knowledge, what is the role of a steroid medication?
Steroid plays a very important role in how we fight any infection. If our body reacts in a way to contain the infection, but sometimes our body goes crazy. And that's what happens with COVID. Your body goes crazy, and your lungs especially react to a condition called COVID lungs. What is COVID lung? Your body has gone so crazy. Your lungs have gone so crazy. They start throwing all this, the white blood cells start producing all this stuff that gets collected in your lungs, and then it solidifies. And so you're trying to stop that reaction from happening. So you're stopping your body from reacting that way, so you're not causing your lungs to fill up. That's what we are trying to prevent. So if you start an early intervention for your body to do that, maybe you will get saved. Maybe you won't come to the situation of low oxygen level. You won't get to the situation of running to the hospital. So to prevent a hospital admission is steroid, steroid, steroid.
Got it. So I have another clarifying question. Should I wait to take the steroids till my COVID results come back, or should I take it at the first sign of the symptoms that I might present? That's
an awesome question. That's an excellent question. So suppose there are 5 family members and one of them has a runny nose and just a headache. The second family member has a fever, 103.5, body aches, and he's coughing. The third person has cough, fever, body aches, and shortness of breath. I wouldn't wait for the results on the third person. I would start the steroids right away because he or she is presenting with that shortness of breath. Shortness of breath is an indicator that your lungs are already in action. They're trying to fight the COVID. So you want to stop that body from reacting. So you want to suppress that reaction before they solidify and become into that the COVID lung. So yeah, start the steroid. I would start the steroid on family number 3, and I would also start on family number 2 because they're coughing a lot more. But I would wait on the person who's just having the runny nose.
Got it. So depending on the severity of the symptoms, despite no results, you recommend to start it.
Absolutely.
Got it. Okay. Another question that was put forward was, how do I deal with a situation where 2 of us in the family are COVID positive, but 2 others are negative? I think you've addressed it early on, but if you don't mind summarizing for this particular scenario, 2 positive and 2 negative in the household, what do you recommend?
Living in the same household, again, isolation. If those 2 people who are positive, if they can be separated in 2 separate rooms, that's the best scenario. But if you don't have that luxury, then put them in one room, the 2 who are infected, the other 2 who are not infected, and they're not sure if they are positive or not, keep them in another room.
Got it. Okay. What if I'm volunteering to help COVID patients in person, taking them to hospitals, etc.? What are some of the precautions I need to take?
Basically, throughout the last 1 year of my being a doctor, what I have done is mask. If you can find a N95 mask, get that and put it on. That's the one that's going to protect you. Do you need gloves? Honestly, till date, I am convinced from the time COVID started to now that gloves are not that important as long as you have an N95 mask. If possible, you don't need a shield, but if you have some good goggles, please put those on. And then whatever attire you're wearing, you don't need like a special PPE to take care of these patients. You just need to make sure once you've taken care of them, when you reach home, make sure all your stuff comes off and you get into the shower and shower. And especially rinse your nose like 10 times and then you're good. But a shield is good. If not, if you don't have it, even your glasses, if they are protecting you, with the N95 mask is all you need. And constantly use a hand sanitizer and keep cleansing your hands. You don't need gloves.
Got it. Can you explain what is the right way to wear a mask?
The right way to wear a mask is always this area. Just watch me. The only thing that should be showing is your eyes. And it should be up to the tip of your nose, like up to the bridge of your nose. I'm sorry. The bridge of the nose should be covered. And it should come under your chin. The mask should always come under the chin because, like I said, it's an airborne disease. You do not want any particles to travel. This is where it should be. It should be tight. It should be on the bridge of your nose and below the chin.
So if, I'm just trying to clarify, wearing the mask under your nose
absolutely not. That's like not wearing a mask. You're inhaling everything around you. No. Even if they are 6 feet apart from you, those particles can travel depending on the air, the humidity. There's so many factors to how this airborne COVID-19 can be traveling. No, you do not want to keep your mask under your nose. No way.
Okay. So advice is yourself, do not put
bridge of the nose under your chin, not even here. Some people, I see them wearing, people who have beards, I've seen them wearing like till here. No, try to pull the mask. If the mask doesn't get pulled below the chin, that means it's a wrong kind of a mask. The mask should fit under your chin and on the bridge of your nose. It should be tightly secured.
Got it.
If it's an N95 also, it goes right like this.
Got it. And so that's good advice, because I don't know if anybody's actually spoken about the right way of wearing the mask. So that's helpful. Thank you.
Oh, I also have to clarify the kind of mask. Cloth masks are not permitted unless they have filters in them. So if you think you're going to take your dupatta and wrap it around your face, that dupatta is not going to protect you. You have to have a filter. A filter with charcoal in it is what, if you want to put that secure on your face, is what's recommended.
Okay, that is if you're wearing a cloth mask with a filter inside. Otherwise, N95 is the...
N95, if it's not available, even a surgical mask is fine. You can double up with a surgical mask. Especially in COVID time in India, I recommend getting a surgical mask. If not, if N95 is not available, and double masking with a surgical mask.
Got it. Or can we wear a surgical mask with a cloth mask together too?
You can, but what's the purpose of a cloth mask? You're trying to put a double thing? No, it's useless.
Got it. Okay, understood. All right, other questions. Is there anything I can do to slow down breathing issues? Like exercises or yoga or any of those type of activities?
I am all for yoga. Yoga does relax your body. Yoga does help you mentally, physically. I think that should be part of your life anyways. But during COVID, when you're sick, there are certain breathing things you can do, you know, slowing down your breathing, taking a deep breath and holding it at the bottom. So you basically take a breath and you hold it and you count. And releasing it slowly. It does help. The reason why it helps is because when you're taking that deep breath, you're making your lungs expand to the fullest capacity even at the bottom of your lungs, so that more air can go in and more oxygenation can happen. I'm sorry, I don't know what I'm saying. But when you take in a deep breath, your lungs expand, you have more opportunity to oxygenate more, and then you hold it. When you hold it, it allows your lungs to expand some more. It allows that air to stay there so that some more of that oxygen can be grabbed by your body. And then you exhale slowly so that, again, you're kind of doing a physical therapy on your lungs. That is an excellent thing to do. And I would do that 10 times every hour on the hour. It'll really expand the lungs and help you get rid of some of the fluids that can get collected at the bottom of your lungs.
Got it. All right. If I just recovered from COVID, do I need to take a vaccine?
So this is the rule. I don't know if they're giving convalescent antibody treatment in India. Do you know?
I don't know.
So basically, when you recover from COVID, 30 days later, you're allowed to take the vaccine. But if you have gone to the hospital and by any chance, if they have given you a convalescent antibody treatment or a plasma treatment, maybe it's familiar for them. If they have given them that, then it's 90 days later that you take the vaccine.
Okay, got it. Are there any ways to slow the progress of COVID to prevent it from becoming serious? I'm assuming you've addressed it earlier on.
Yes, that's why I'm going to give them that power in their hand, like a supply. The moment they get the symptoms, everyone starts on this treatment and hopes that your body doesn't go crazy, and it slows down the reaction and helps you from going into the hospital, which is the steroid, which is called the dexamethasone. This is the drug that's going to save you. If it's not available, there's one more, which is called prednisone, but I'm going to give you both the choices. Get it. If you have the supplies, do whatever you can to get it and keep it in your house.
Got it. So on talking about supplies, there's a question. Do I need to buy an oximeter oximeter/vaporizer if I don't have COVID?
Oximeter is a must because it kind of guides you like to see how you're breathing, right? But you shouldn't depend on it completely. If I'm sitting here and I have COVID and I'm breathing normal, then I don't need to check the oximeter. But if I'm sitting here and I'm like coughing and I'm like, then yes, definitely check the oximeter. People are going bananas with these oximeters and I don't really like it because even in my clinic, when we use the oximeter, sometimes it shows that I'm 94%, but I'm perfectly fine. It can be inaccurate, you know, it's just a little gadget that can, you know, so don't treat a gadget, treat who you're looking at and how you're feeling.
Got it. Is there a chance that I've got COVID in 2020? Is there a chance that I can get it again in 2021? Or have I built immunity?
Absolutely, you will get it again. You know, it's mutating too fast. It's changing so much. Like, you know, the way it's replicating and changing genetically, they haven't proven that, just like how the flu virus is replicating and it's changing. So the vaccine, or even if you've gotten an infection, your body might not have the antibodies against that particular one that's going to be there 3 months from now. So yes, you might get it again.
Got it. Are there any myths that you would like to bust today on this call for our team in India? I know that we have family members in India who are struggling with this at the moment. So is there any advice that you have, or myth-busting advice that you have for our team in India that our families may have faced with?
You know, I don't have a problem if someone wants to do haldi water or honey water or lemon water or drink only hot water. I mean, you can do it, but you have to do what is science also together with those myths. You know, your mom wants you to do cinnamon water with honey and things that is going to kill the COVID. Go for it, but don't ignore science. Follow what science is telling you. And no courage can beat COVID-19. It's something different. It's weird. It's mainly how you are genetically made, how your body's going to react. So you just basically have to see how your body's going to react to COVID-19. But be ready for it by having the right kind of drugs. You know, see if you can get a CPAP machine in your household. Those are the things you can do.
Got it. So in terms of psyche and preparedness, what kind of advice do you have for the team in India, knowing that there is a lot of panic, there's a lot of distress, family members who are passing away, and there's a lot of panic and anxiety for people building up with COVID going around? Any advice for them that you would like to leave them with?
It's sad reality, but unfortunately, guys, you don't have an option. My only advice to you is the next 3 months, make your home a capsule where no one can even put a needle through it and cause air leakage. That means literally your household, whoever lives in it, are the only people who are going to live in it for 3 months. That means even a servant cannot enter. Your supply guys can knock on the door and leave the supplies. Even those supplies are considered as micro needles that could damage your capsule. So you have to create this capsule. You have to create it, and you have to create it so no one can even puncture it. My advice, even your supplies, leave it. Have a big tub, have soap water in it. Let them drop the supplies into that tub. Wash them, bring them inside. Don't let anyone puncture your capsule. The next 3 months, if you have to eat only dal and rice and survive. That's the only thing I can advise for you. Don't try to go find vaccines at this point in time. My advice, yes, vaccine is super important. I want you all to get vaccinated. That's my sincere advice to you. But right now is not the right time, because you go in and you stand in a line and you get infected, you have chances that you might get super sick and land up in the hospital. My advice is stay in there, stay indoor. If someone comes and knocks on your door and gives you the vaccine, take it, but don't go looking for it.
Okay, awesome. Those are all the questions that we have for today. I appreciate your time, Dr. Anwar. It's kind of weird for me to call you Dr. Anwar, so I'm just going to say Faizun. But thank you so much for giving us all of these insights and so forth. Is it okay if any other team members have any more questions that I can direct them to you, maybe email them to you? And
absolutely, give them my phone number. If they have any questions, anything, and I will send you the list of the medication so you can pass it on to the team. But I'm here. So if you need me, call me.
Awesome. Thank you so much again.
You're welcome.